Hello, everybody. Oh, what a wonderful moment we can share together now over the next hour. I'm so delighted to be with you and having this opportunity to take the place of the wonderful Sue MacDonald to host this week's Midwifery and Maternity Hour. And I'm delighted this week that I can be joined by the brilliant Laura Rose Thorogood, CEO of Make Birth Better, but also founder of LGBT Mummies. Hi, Laura Rose. Thank you for being with us tonight.
Thanks, Anna. Thanks for having me as well. It's lovely to be with you all.
Yeah, and we're so grateful to the Midwifery and Maternity Forum for hosting us, for Neil and Angelo who are here helping us and making us comfortable. And I don't know about you, Laura Rose, but I'm here and it's the sun is setting just outside and it's getting really dark as winter sets in the UK, and I'm up in the north of England. Where are you
Yeah,
joining us from?
east of England, but the sun's already set, so set a while ago. So we've
Yeah.
we've got pitch black now.
I'm just waving goodbye to it. I can just see the hint of
Oh,
orange
really?
on the edge.
No,
Um,
ours is gone.
yeah. Well, it's my name's Dr. Anna Byrom, and I'm the CEO of All for Maternity. And it's actually really nice. We were chatting before about being CEOs of small organisations with big hearts, and it's so nice to be with somebody else that shares that opportunity to help and make a difference for all of the families that we're aiming to serve across maternity and perinatal care. And can't wait to find out more about the work that you're doing with Make Both Better and all the work you've done in your career to make a difference for families. But before we dive into that and what the focus of today is going to be, I thought it'd be nice, like Sue always starts with a moment of the week and thinking about something that maybe has felt really positive for you. So I wondered if you wanted to share what's been a highlight for you this week.
I think probably it always comes back to the kids. So it's my third. We've got four children under 11, so it's pretty busy constantly. But our third little came home and she had won Star of the Week. But we'd
Oh,
already we'd already been told, or the other children told my wife on one of the pickups, oh, by the way, she's won this. So we knew, but we had to pretend that we were incredibly shocked. And she came in and I was working and she came into the office and she was shaking with excitement. And she was like, couldn't get her words out. She's like, Mummy, look what I got. Look, you're not going to believe this. It was like this. I was like, tell me. And then had to act completely surprised, and we were all like laughing. And she was just so excited. But it's those little moments, isn't it, when they are just incredibly cute and just good memories, aren't they? When they get their first certificate, and it was for being kind and helping others, so it was quite cute. But she was just incredibly proud, and now she's got it up on the side. She won't let us move it now. So yeah, that's been a good thing this
oh,
week.
it's nice to celebrate these special moments, isn't it? And then
Yeah,
I've actually in the other room, I've just settled the children down with some
mm,
pasta. Will's just got back from his sport thing, and he's put his up on the mantelpiece from a
yeah,
few weeks ago. It's still there on the side, but it's nice to celebrate our children and be alongside them.
yeah.
Um, but I think my moment of the week has actually been yesterday. I hadn't managed to eat anything. You know, when you just sometimes get to
Get
late
busy.
in the afternoon. And my lovely boyfriend, Chris, came by on his way to work. He works sort of in the evenings, and
Yeah.
he came through just and handed me a plate of lovely vegetables and food that was nutritious and yummy. And I
Nice.
thought, oh, it's sometimes nice also to be cared for as well, isn't it?
Yeah, your own little chef passing you food when you most need
Yeah.
it, reminding you to do the things that you must and need to do. Pretty helpful.
Yeah, really good. And there was a little sub parcel to help the kids out and feed the kids, which always helps, doesn't it? So these little
Yeah,
acts of kindness, I think, are so important.
yeah,
So
definitely.
it's lovely to think about the focus of our hour together tonight. It's been really inspiring for me to watch all the work that you've been doing to support Make Birth Better as the new CEO and seeing the work. I've always been such a it's so inspired by the work that Make Birth Better have done. And I'm been lucky in the past to collaborate with some
Yeah,
of your team on some projects to really make a difference to how we can support families to feel well, but also staff to feel well in the work that they
yeah,
do. And really love that about your work. And I can't wait to hear more about the plans you've got ahead and some of the incredible work that you've been doing with a massive collaborative of organisations to help really respond to supporting the ambitions of really transforming our maternity and perinatal services here in the UK and beyond,
yeah,
really, because things that we do here really make a difference elsewhere too.
yeah,
So the focus when we chatted, we were thinking that it would be good to maybe share how really there is so much strength in collaboration and connection and community building. I see that
yeah,
as part of what you do at Make Birth Better. I'm
yeah.
really grateful for that. I don't know if you just before we dive into the importance of collaboration in action, if you wanted to share your thoughts about collaboration and why you see it as so important at the moment.
I think when there are issues in a system and they're institutionalized, they're consistently like the inquiries are happening, people are trying to address inequities and equalities for not only service users but staff as well. If you're getting the same output and nothing's changing, then something needs to change about how you address that and what that looks like to get to that solution of improvement. And I think when it comes to collaboration, whilst there's always so many wonderful organisations doing great work, but always working in silo, working alongside each other. And I think removing that and bringing people together as one voice ultimately means that there's space and a seat at the table for everyone, especially those marginalised communities or those that have, hate to use it, seldom heard. They're not seldom heard, they're not hard to reach. We're just not reaching them in the right way and giving them that space to pull a seat out for them to take a seat and eat. And so bringing people together and collaborating as one voice is so much more powerful than all working in different silos, which can happen, and that's really positive. But when it comes to a national piece of work that needs addressing, the collaborative voice is much stronger because at that point you can co-produce what that looks like and make sure it's much safer, compassionate, and inclusive for everyone.
And I think this is just we all can come together and support, Professor Amos and the team that she'll be bringing together to respond to the National Rapid Maternity Review, bringing
Yeah,
together all of our learning and the lessons, and from all the different reports and reviews that have taken place all across the years, really,
yeah,
periodically, but then very rapidly over the last 10 years, there's been a lot of reports and reviews and all of that learning that can be brought together. And it's really great that organisations like yourself are also helping to do that. And it is something that I know many of the leaders, maternity researchers, midwifery researchers, academics, educators, clinicians, and families are all wanting to come together to be part of that solution. And I just wanted to take a moment to acknowledge all the families that have already shared their stories in lots of ways and sometimes often repeatedly,
yeah.
and how critical it is that we continue to listen to those and the diversity of their voice and perspectives and seek to hear more voices. And I think that's something that I really see the work that you've been doing is to help really sort of grow even more voices that we can hear. And now's the time to share. So thank you for giving us a nugget of the things that you've been doing. I can't wait to hear some more. But I thought it would be nice to frame this hour together with some thinking about what do we mean by collaboration and
Yeah,
have a little moment to reflect. And for everybody that's watching us live, a warm welcome to you. We hope you're feeling comfortable sitting somewhere. I know many of you might be listening to this as you journey or travel or go out on a walk, maybe just to catch the last of the sun, um, or you might be traveling home from a busy working day. I hope you're okay. We're here to care for each other and we welcome you. And if you're catching up on this session with myself and Laura Rose, we're really glad that you could be here with us and listen to us. And we're really open to you getting in touch. We really invite that, both of our organisations, as at all for Maternity, but I know all of the team at Make Birth Better, you can find us on social media and we love to hear from you. And we hope that you can follow along and get involved. And there's some ideas of how you can get involved because that can also feel tough if you're not feeling part of an organisation that maybe is visible or you're feeling that you're unable to share your perspectives and voice. That's something that we wanted to bring to the table in this hour on ways that you can take part and feel included. So I'm just going to share a little presentation just to encourage people that are watching to think about some of the things that we feel are important. So in this presentation that I'm sharing with you, um, I think it's just to frame this whole hour. We want to kind of talk about collaboration in action, and a big part of what we do in our work is underpinned by compassion. And for me, compassion is listening. It's got to always start with attending, listening with fascination to as many voices and people as possible. It includes reading and learning and looking at the evidence, which also captures diverse voices, looking at the reports and the reviews, but trying to then move into understanding beyond our own perspectives, and then being able to empathize the best we can. And I think through that empathy, it drives us to the fourth and important part of compassion, which is helping and acting. And I think that's something we've all been driven to do, is to be part of the action to make a difference together. So, like you, Laura Rose, and your team, many of us that have been working collaboratively in different ways, we felt that it was really important to come together and share ideas and perspectives and be supportive. And a group of us have come together, including obstetricians, midwives, researchers, leaders, organisations, and clinicians and families have come together as a maternity and midwifery birth collective, just again to focus on some of the acute issues that were arising that we wanted to be able to collaborate on and discuss in a meaningful way. And I know there are many other organisations that are coming together as well, like all of the professional associations have come together in a partnership, which is also really fantastic to see, those collaborations all occurring. And like you said before, Laura Rose, it's really great that we can come together as well as collaboratives with many voices coming together and always open to coming and sharing and discussing things which we're hoping to share together tonight. Because we are facing challenging contexts and we're seeing emerging articles coming out about maternity crisis alongside all of the reviews and the underpinning justifications for this rapid review to bring together all those lessons, and hopefully thinking about how we can really redesign and reconsider how we approach maternity and perinatal care moving forwards, including everybody that's obviously primarily the people being using those services and having them at the heart of everything that's done that happens, but then also the people providing care in those services. And I think that's so critical that we come together to address the challenges together, recognizing them, but also understanding we can move forwards together to brighter days. Because sometimes I think when we're facing challenges, we can feel like we're at the edge of a precipice, and it can feel really quite scary. And I think taking a moment to notice that all of this concern that we feel out of our deep commitment and care for making a difference, and for all the families that are having to continuously fight for their own rights, the rights of their families. It has a massive impact on our nervous system, and we know the impact of that. So I just think sometimes we can all feel this in our work, and taking a moment to recognize that and care for each other is what we need to do in order to feel well, so that we can sustain the work that's needed to build a better future. But sometimes when I'm feeling like that, I take a moment to sit back. I suppose sitting back with you tonight, Laura Rose, feels like this for me, that I can kind of look up together. And then for me, just sometimes we it's really important that we all have really different points of view. And for me, they seem like the different mountains in the distance, that we're all on our own journey. We're all on our own journey up different mountains with different challenges and different priorities. And that's so brilliant. But if we can take a minute from the top of our own mountains, even if we're not where we want to be, I think sometimes when we look out in the distance, we recognize, I'm part of a much bigger landscape here, and we're all part of it. And there's just something really important about recognizing that I really want to learn about the other journeys and the other mountains and the other landscapes that are around me. And I really want to get to know more points of view and perspectives. But there's something important about still recognizing wherever we are in our own journeys that we're all part of the same community and we're all part of the same picture. And so I just wanted to put this slide on because I think it always helps me to have a different view and to just take a moment to look after our nervous systems because after a big journey up a mountain, we can feel exhausted as well. And it's nice to be, I always do it when I walk up our local Pendle Hill near to me here. I'll always take a minute to just have a pause and I'm like, oh, I must look at the view, but really it's just have a rest whilst you're going up the hill. But we do want to know the way. And I think some of what we're going to learn from all of the reviews and the work that we're doing is we're going to work our way to knowing the way to move forward. But I always feel that it's always safer to do that together because it's where connection and community and where we can share vulnerability and be inclusive and where compassion is able to flourish, where we can really start to understand each other and to create a sense of collaborative approaches in our work moving forwards. And we know it's really worth doing that, like listening and learning. It creates a more civil community where we can really learn to approach each other with generosity and openness and bravery. I actually think really healthy teams are able to hold diversity and complexity together. And we do want to avoid incivility. We know that actually civility and moving towards civil workplaces and spaces actually saves lives. We know it makes such a difference, and we know what a difficult impact it can have when we don't create civil spaces for us to learn together. And we know just looking at the Civility Save Lives website, it's a great resource to give you insights into the importance of this in our work. We know that even if you witness incivil behaviour, it has a knock-on effect for you, the people you work with, and when we're in maternity and perinatal care or any healthcare or any service, it's going to actually have a consequence on the people we're aiming to serve. And we know that from the reports that we're hearing time and again that workplace cultures, have an impact, both positive and challenging cultures can have an impact. So what we're aiming to do through fostering collaborations is learn how we can also influence positive cultures across maternity and perinatal care, which we feel so critical. And you can see that it's been well mapped out as well across some of the leadership literature in the NHS and some of the reviews that have taken place. And we do know that really strong and positive leadership also can help make a difference to how we can foster these relationships in workplaces as well. But I think it all comes down to something that I think's really what I've been in awe in with your work, Laura Rose, has been the way that you create a sense of belonging through your leadership style and welcoming such a wide range of organisations to come and collaborate with you. And it's that sense of belonging that you're holding is something really important. And I think the feature of belonging for me is that you can come as yourself and be yourself. And we only can really feel like we belong if we really can be as close to ourselves. I know we can't always be 100% ourselves. We're just human beings. But if you in a space where you feel you belong, often you feel you are being yourself. And I think that's what we would want in every culture and community, in every workplace. And I think that's something that we want certainly for families to feel when they use maternity and perinatal care, that when they come along, as soon as you walk through the door, you belong. And I think it's important that professionals and people providing care, that's our priority, is to how do we help everybody belong here, see themselves and feel that they can be themselves. And something I'm always looking for ways that we can really be conscious about this in the work that you do and the behaviours you foster. And this book, I think, is absolutely brilliant at helping to unpack it. Like, how do we do this in our workplaces, but in our organizations or in the work that we do? And I would invite people that are watching to go and read Inclusion on Purpose, an intersectional approach to creating a culture of belonging at work. And I think if we can do this with each other and with our collaborations, I think it'll make it so much easier to foster it for families in our services. And some of the 6 things that you're invited to consider when you're trying to implement this bridge framework, these 6 principles of the bridge framework are just captured there in green. It begins by us recognizing we need to be uncomfortable. I said at the beginning that that also, though, can lead to us having our vagus nerve and our nervous system triggered quite a lot. And so we have to also recognize that we need to look for support and care for each other, because when we're at this space where we're wanting to drive change and make difference, it can also be really burdensome and challenging, rightly so, rightly so. So we want to reflect on what we don't know, and we can only find that out by listening to other people. We want to invite feedback, avoid being defensive, which is so natural to get that defensive feeling, but can we work through it together and listen and learn, growing from our mistakes, but allowing for mistakes to happen, recognizing that's really a normal part, the human factors and ergonomic, that's a part of life. So let's sit together with it and help each other to move forward and grow and expect that change takes time. So I thought this was a good framework for us to think about inclusive belonging. And there's a lot we've got to do because, as you said at the beginning, Laura Rose, there's an ongoing injustice and there's ongoing discrimination and marginalisation. And, in particular, systemic racism that needs huge pieces of work to address within maternity and perinatal care and wider health, social care, and of course, our society. And we are living in a time of real political strain and conflict across our wider society as well, that all has impacts on how we provide maternity care. And I think as health providers and healthcare supporters, we can really be in a strong place to address some of these challenges together. And I really love this framework of how guiding people on the call that are doing work themselves, because it's a lifelong project, personally and professionally, that this is a really useful tool to think about that using the growth model, how we can grow and we encourage our children and our families to support them in their learning to push themselves outside their comfort zones. And I think it's a really good tool for thinking about how we can become anti-racist in our practice. And you could apply this to any area of discrimination, minoritization, or marginalization. So thinking about how we can move from the fear zone where we deny there's an issue through into the learning zone where we might seek out learning and answers to the questions that we might have, moving through to the growth zone and identifying um, all of the ways that we might have had concerns and issues and how we can move forward and pass those to a more safe approach to our work and care. So I think it's just a nice way of looking at and thinking it through personally and professionally. But I always want to remind us that we do this in a calling in culture where we invite each other into the conversation as best we can without damaging our own boundaries and making sure we care for ourselves. But it's really useful to think about how we can call each other into conversations for learning and growth. So creating belonging involves this sort of working together and learning and listening, and being quite connected, which is the essence of this work. And that's what really underpins the Midwifery and Maternity Birth Collective, that's really just here to be as open and inclusive as it can feel and be. It was just a range of colleagues and people from across the country that wanted to come together and talk about what could be done to make a difference and be supportive of the next steps and contribute. I think it mirrors what you were feeling as well, Laura Rose, with your work and the things you were doing. So it's just this multidisciplinary group of midwives, obstetricians, families, academics, maternity care workers, advocates, and supporters. And just this united commitment to addressing these urgent challenges facing midwifery, maternity, and perinatal care in the UK, but also always recognising that that impacts on beyond us in the UK as well. So the way that we thought we could meaningfully do something straight away was to help bring and share meaningful resources that are supportive. So, updates from the maternity review, sharing recent articles, opportunities to join webinars, or, for example, sharing a bit of news from the collaborative work you're doing, Laura Rose. Anyone that wants to share things that they're doing locally or nationally, we can share it. So people can join. If you're watching this from your desktop, you can join by scanning the QR code on your phone to join a newsletter where you can just be shared information and updates, and that can feel supportive because it can also be challenging to stay up to date and informed. So the goal is that we're helping people to listen, learn, and act and be part of that inclusively. We've actually got over 400 people that have joined the mailing list to stay up to date with these key issues. So we're putting out monthly newsletters that just give you an overview of some of the key things that we're doing as a collective, and then any opportunities that we've seen. You can kind of join in and get free access to the webinars and seminars and catch-ups. Any sort of blogs that have been written or articles that have been sent in to us or shared, you can read them and get access to them through here. So you can see this little video is just scrolling through the first newsletter that we shared. And then there's some articles as well that have been written by Professor Andrew Weeks and others in the collaborative. There's the report from the 5 Times More that was published recently, links to conferences and events that you can attend, all included together so that we can try our best to support each other alongside the work that's been done across social media and beyond. So we managed to do our first seminar series, which was addressing the crisis in midwifery and maternity care, where we were able to sort of unpack things together. You can still watch this if you're interested. It's free. You can go on and use the Birth Collective code and go onto the hub and do a catch up if you're interested. But for just as a little overview, we heard from Professor Dr. Andrew Weeks, who's a professor in international maternal health, Dr. and Professor Sue Down, Professor in midwifery, Dr. Anna Horn, medical anthropologist and doula and birth activist, and Dr. Claire Feely, lecturer and researcher in midwifery maternal health. And they took a different perspective, thinking about the challenges and issues from different points of view and shared them. So Andrew talked about the perfect storm and all these confounding factors that are influencing and impacting on safe maternity care. Sue talked about some of the challenges with the midwifery workforce and morale across midwifery. Anna talked about the impact of birth justice on birthplace and restrictions over choice on bodily autonomy, and some of those issues affecting racism and discrimination. And Claire talked about how we can optimise physiology across all birth experiences and in all birth settings. So really good start. We had lots of panel discussions, so everybody that comes along to the seminars can get involved and chat and share their points of view, which is a really supportive way of feeling that you're part of the community. You can share and ask questions, and everyone's able to catch up with the learning afterwards and get a little certificate. And what we learned from the first seminar, with these are some of the themes coming across. We have had over 100 people join the first seminar, and these were some of the themes from the things that they were saying. So, challenges around education and workforce, access to birth settings, restrictions to home births, and midwifery-led units closing, challenges around recognising birth trauma and psychological safety. And people shared links to the recent birth trauma inquiry along with other resources of information and sources of information, the importance of the need for professional wellbeing and support. And there was lots of resources and research shared on the day. So the next seminar is going to be on the 23rd of October, hosted by King's College London with Dr. Claire Feely and Dr. Carol Kingdon, a sociologist working at Liverpool University. If you want to join in, you can. It's hosted, like I said, through King's College London, and it's going to be looking at evidence-based maternity care, looking back to move forwards. So feel free to join in. It's just always remembering that ours is a work of heart, and no matter where we support people to have their babies, whether it's in a hospital, home, or whether it's a cesarean section or a pool birth or whatever mode of delivery, we want to make sure that at the centre is always the family, their needs, their preferences, and their clinical requirements, and that we're offering safe, compassionate care. So I'd love now to welcome Laura Rose Thorogood, who is many things, including the CEO of Make Birth Better. And you're here sort of largely in that remit tonight, but I know you do so many more things, Laura. So just before we open up to our conversation together, I wanted to tell everybody a little bit about you. So would that be okay if I share?
That's fine. You can do it.
Oh, I hope so. So I'm going to just tell you a little bit about Laura Rose. So Laura is an LGBTQI plus IA plus maternity and fertility activist, educator, writer, speaker, and campaigner. So a busy person. She's a married lesbian mother of four donor, beautiful. I've heard them, and when we've had phone calls as we prepared for tonight, beautiful children conceived by IUI and IVF. She's both a bio and non-biological mother and has lived experience of operative birth, failed cycles, miscarriages, secondary infertility, and birth trauma. I'm really sorry that you've had to face that, and thank you for sharing all your learning. She's the CEO of Make Birth Better and founder of LGBT Mummies. She works at the University of Oxford and lectures at University of Cambridge and others. She's often within Parliament making recommendations to the government, NHS England, and is passionately campaigning for inclusive law reforms. She holds multiple roles across NHS England, the Royal College of Obstetrics and Gynecology, UCL, HFEA, MMHA, and influencing change to create equity, equality for all marginalised communities. Wow. It's amazing the work that you do and have done and continue to do. Thank you so much for being
Thank you.
here tonight. I can't wait to ask you more questions and chat together about the work that you've been doing. So I don't know if you want to share with me, when did you become the CEO of Make Birth Better?
It's only actually been 3.5 months, so it was more mid-June. Um, so it seems like a long time ago, but not that long ago. So it's gone quite quickly.
Yeah, and you've just done so much together with the brilliant team. Could you tell me a little bit about your team at Make Birth Better? Would you tell us a bit more about Make Birth Better as an organisation?
Yeah. So, Make Birth Better have been going for a decade now, and they're an organisation, a CIC, that is there to educate, support, campaign for better maternity care, but to support service users and their families, but also to support healthcare professionals. So that is at the heart and ethos of everything we do to improve the maternity care setting and ensure that professionals are given a safe space to be educated, supported, but also heard,
Mm.
to develop them and their knowledge, but also to support them through the vicarious trauma and the experiences that they have as well. And of course, to provide support to those families that have been harmed through whatever experiences they may have had, and ensure that we can work together and co produce with other organisations how we can improve maternity care once and for all. So that is at the core. And we have a wonderful team of over 11 women and people that are passionately dedicated to the cause and have their own experiences of trauma through birth and maternity services, but that have come together with all their expertise, clinical psychologists, experts by experience, just an absolutely brilliant team of people that are passionate about safe, inclusive, and compassionate care for service users and again for staff as well.
I think it's looking after everybody in the ecosystem with a focus on the families. And I think it always feels like if we care well for parents, for the people having babies, giving birth, and in the process, if we care so well for them, then our babies and our community and our
Yeah,
future is so cared for. And I always feel like that if we care for staff and the people providing services, they too will care well for the families that are
absolutely.
supporting families. And
Absolutely. And that's why we're really passionate about the education and training that we do as an organisation to uphold and uplift and support and empower them and to give them that safe space because often we can't make the assumption that all professionals harm or they set out to harm, but we also need to appreciate that where harm does happen, it can also happen to healthcare professionals as well. So for them to be safe and supported is important just as much as service users, and we want to make sure that the work is done and they're equally supported through their journeys.
so just tell me a little bit about, I know you've got like four core focuses as an
Yeah.
organization. I know you've been doing work on sort of developing that focus and what are those sort of core ambitions or goals of Make Birth Better, would you say?
It's, at the core of what we do as an organisation is the education and training and supporting healthcare professionals through trauma-informed care. And what does that look like? And what other pathways that need to be appreciated, supported throughout the education that they get access to and supporting them through their journeys, but to also understand, especially those marginalised communities of the poorest of outcomes, what their needs are, the cultural needs, their identities, their journeys, their family formations, and what prior trauma they may have experienced before they set their feet into the maternity setting. What does that journey up until that point look like? And how can you be armed with the training and the tools to have the knowledge to support them in that inclusive, safe, and compassionate way? So, giving that safe space for them to ask the questions, to not be fearful, and to understand that they are also there to be supported too, to then improve the care that is there for service users and improve the system as well, whilst
Mhm.
absolutely acknowledging that systemically there are things that are very institutionalized. There are things that we cannot change. They're seismic. They're systemic in regards to, it might be a digital system you can't change that impacts a marginalized community. It might be the layout of a building that you can't impact. But what can we change and how can we take action to do that and empower those staff? It's really important.
Yeah, absolutely. And I think, revisioning though together when there is an opportunity to work with architects and others to really think differently about any time there is a chance to rebuild or reconnect or
Yeah.
create different settings, we know what a difference they can make. That whole ecological look at care and birth in that whole setting of how good policy and really important understanding of our backgrounds and those, like you say, those cultural differences and our families, our wider families and the communities we're from. And I think if we
Yeah.
can look at that from an ecological perspective, it allows us to see all the different variable factors that can make a difference. But you're right, like I always think that sometimes we feel like we're not making a big difference, and the small things we're able to do each day don't build to something big. But I actually think that we can make a big difference also by committing to those small acts. And I think that's what I've always loved about the resources you share, even the resources you've got for professionals about how they can care for themselves and
Yeah.
understand their own trauma and how that could play out to then them re-traumatizing others.
Yeah, exactly. And I think it's really important that there are different streams to improving the services and the system. It's not just about the training, it's about, what does support look like for people in the space, professionals and service users, but how can we influence change at that kind of higher level, that strategic level within the system, at a national and a localized level, because of course have to understand and appreciate what's happening at a localized level might be happening in pockets, but are there national issues as well that's impacting
Mm.
and causing further harm, further trauma to women and birthing people and their families and their support networks and staff, and how do we address that?
Mm.
So I think from our campaigning perspective, it's really important to look at that and say, well, what now? Where's that so what piece? How do we take action and what does that look like? Because often so many of us are doing such great work, but how do we move to the next level to improve the services once and for all?
Oh, absolutely. And I love the work that you do that. And I think this has been such a brilliant part of the actual actions you've taken to bring people together. I wondered if you might share with people, because we've been talking about collaboration and how we can come together as a community, and a diverse community of people. And it's been so inspiring to see how you, as an organisation, have brought together so many other organisations to come and share. So I wondered if you could share a little bit more about that and when did you begin it and how has that emerged?
I think being an activist and campaigner is just inherently, intrinsically part of who I am. So when I'd literally been in post a few weeks and it came out in the news, it hit the media about the investigation, and we just all looked at it and said, another one. And the use of the language, rapid review, the turnaround was so short. And again, another review. What's going to come out of that? Is any action going to come of it that's going to really change the system and improve the service? Or is it going to be another tick box? Is it going to be another
Mm.
failure for families and staff as well? So at that point, it was, we're all doing great work in the space, but why are we not doing it together? There's power in collaboration, there's power in one voice. So it was about reaching out to our friends of Make Birth Better and organisations in the space like yourselves and saying, let's come together, forming a national working group. And when I say national, of course, there are some amazing national charities and organisations in there, but we've also got localised organisations, those that never get a seat at the table, those that are very seldom heard because they're not reached properly and they're not supported and brought to the table. And we have a collective of over 100 organisations now that are part of the working group that we've been working together on to form a list of priorities to say this is what service users and their families and staff want, because whilst experts of course are very important in something like this in a review, you also need service user voice, and it can't be pockets of service users and pockets of experiences. Incredibly important, but you need to have the narrative from a breadth of experiences and what that looks like.
Mm.
So bringing together every marginalised community, every national and grassroots and organisation in between has meant everyone's got a seat at the table. Everyone can co-produce that plan and priorities and what that looks like. And so we've only had 4 meetings since it came to the media and was released and announced. And in those 4 meetings, we have compiled really cohesively a long list of priorities that we're working through and finalising to say this is what service users and staff have co-produced together to say this is what we need and here are the potential solutions or actions that can be taken once and for all. And excitingly, we are near the end of that, and we have had word this week that we have got meetings that we've requested with the investigation team that are due to come up. And one of our main points at Make Birth Better was we don't want to consistently be leading and be the voice. We are facilitating the space that everyone can be part of. But at the same time, when that meeting comes, we want everyone to have the opportunity to be present so they are part of it. And that's where that co-production and that collaborative voice is really crucial. It can't just be one organisation leading the charge. It is a group of us, a huge group, one voice to say, this is our priorities, this is what we need. We're here to support you
Yeah.
because Baroness Amos has got a huge task on her hand with that investigation team. But to do something so seismic in such an incredible short amount of time, which of course we know, is it going to be viable anyway? Is something that you need helping hands with. And having 100 organisations say, here you go, this is what we all have said nationally we need, is only going to support in a positive way and support the work that needs to be done.
And I think I mean, it just congratulations to you and all of those incredible organisations for making the time and space to come and share and to have the knotty and very important jostling of ideas and perspectives and
Mm.
views and the richness of that. I think the when you think of 100 over 100 organizations, it isn't just one person because all of
No,
those organizations, like you said, are working in grassroots way with local communities and
exactly.
touching so many voices. Because you just think how many voices, if we count up, we're so grateful to be part of that and being able to come and listen as an organization to all those other organizations. And we bring the voice of over 30,000 members in our organization.
Exactly.
And it's just wonderful to be able to think, well, that's an incredible collaborative that you've created.
And like you said, obviously the organisations that are there and their colleagues that are involved are touch points they are feeding into because they've got their ears to the ground. They're hearing, listening to those communities to say, this is what we really need. And ultimately, what has been central to the collaborative working group is that if we centre the most marginalised, the most poorest of outcomes, those that aren't listened to and uplifted and get that seat pulled out from at the table, ultimately the majority, their outcomes and their opportunities and their experiences will automatically get better. So making sure we are being incredibly compassionate and careful of each other and of those that are most harmed and saying, what do you need? And let's centre that. How do we change it from that perspective? Because again, conversations were had, that's never really been done before. It's been very generalised, very for all. If we centre those marginalised communities, what does that look like? What kind of change will we create for everyone, not just them? Because Black women and birthing people are dying, queer people are being discriminated against, disabled, people with low socioeconomic income. There's cultural needs that are being ignored and missed that are so inherently important to these families and staff. What does that look like, and how do we improve it moving forward?
Yeah, and I just think it's all the brilliant organisations that are creating a voice for people that have faced bereavement and loss and
Yeah,
grief and trauma and people that are facing the impact of mental health and long-term health conditions that really make it more challenging for services to maybe to have a voice that feels heard and constantly acknowledged. And I think that's something that is incredible about the work that you're doing. And thank you so much for sharing it. I know it's sort of all hot off the press because you've been working at pace to be a support to Baroness Amos and the team. And we all want to be there to support everybody in this space. You know,
yeah,
like you say, all of um, the partnership working that's happening with already, with all of our associations and professional bodies, how wonderful to bring all of that group together and
yeah.
then to have the review groups coming together and
Yeah.
you creating this diverse space and
I
with
think it's got to be safe for everyone. And I think that's something that we wanted to make sure was centred, that it's not just about, I'm a service user, I've had harm, long-term physical and psychological implications from my past experiences, but I've also got to hold centrally that that doesn't always happen with every member of staff. That's not something that will happen to every single person. But how do we change that cycle? How do we also hear staff and uphold them through the trauma and the broken system that often they are inheriting when they walk through the door? Because if we're not caring for them, how can they care for us? we need to really be considerate of everyone that is impacted by the experience. And what does that look like? And how do we dismantle the system and start again and say, this isn't working. What can we change? And how can we improve it for everyone?
Oh, absolutely. And all care is a relationship, isn't it, at the heart of it? And I think you fostering all these relationships, and the relationships that they foster, like we said, with all of the communities, will be able to make the difference. And again, going back to building a relationship with the review team and everybody involved in that, and recognizing how challenging that's going
Yeah,
to be for everybody involved, and wanting to be there to support people that are giving themselves to that work.
yeah.
Um, I think because we're coming up, can you believe it? We're coming up towards the end of the hour together. I did, just before we move on to see if there's any questions coming in from those watching live, want to just link back to, obviously you founded the LGBT Mummies. I just wanted to know, because I know you run that still, don't you? So you're,
My wife does.
oh, thank
I
goodness.
do. I do
Yeah.
the face stuff because it's not that's not her thing. But no, she has fully taken over that now,
So you've been
which
able
is
to
lovely.
sort of make that transition for
Yeah,
yourselves, but
yeah.
it's still very much connected to who.
Very intrinsically linked because we were already quite entrenched in maternity services and the system anyway, and do a lot of training for NHS and NHS Scotland and other organisations. But again, marginalised communities, there's that intersectionality. I'm a queer woman of mixed heritage. I have brown children, and there are experiences that we all hold and have
Mm.
that are linked, and seeing the experiences of others and knowing that you can change that if you give safe space to people to share and explain that where they're feeling and what they need, then that can ultimately improve things.
Oh, well, I'm so grateful to you and your wife for that work that you do to help everybody to see themselves, but most importantly, to feel that they can access care in a way that's meaningful, appropriate, safe for them. And I just think it's incredible to hear the work that you've done and continue to do. Thank you. So there's a comment come through rather than a question, but
Mhm.
so just from Yasin Sagnia Jeng, I'm not sure if I've pronounced your name right, I hope so. But saying just such an interesting and educative program. You guys are really inspirational. I'm grateful to be here. Collaboration is key. Yes, sense of belonging is really important in every workplace, though it can be a bit sensitive and challenging. I suppose that's something maybe we can ask, and from that comment is at Make Birth Better. I saw on social media you had a lovely away day with your team. But how do you, as a CEO, how do you foster that sort of sense of belonging within your own team at Make Birth Better? The things that you do, that tips that maybe you could share with other team leaders and people that are joining us.
I think it's early days, and I probably wouldn't be the best person to be giving tips out to people at the moment. It's hard, it's difficult, but I think just trying to listen to your staff, and I've probably come in at pace, and we're doing a lot of great things, but it's also about slowing down and assessing what the landscape looks like. And I think at the moment, maternity services and a lot of organisations, there are lots of organisations out there wanting to do good work that are sadly at risk and struggling because of the
Mm,
landscape. And I think it's acknowledging that and what that looks like. And
mm,
I guess what's viable, what can be done,
mm.
but also, wanting to take action in a strategic way to make sure that we're having like a good impact and it
Yeah.
supports people in the best way. And what does that look like?
I think that's such wise advice, and it's lovely to hear you acknowledging that, you're new and the newness and that transitional time for you personally, as well as professionally for your team, but just pausing. Something else that I was going to put in the slides was like this feeling of being in a jungle, when there's so much coming toward it, could even be like a tsunami. But I sort of think the jungle feeling that we can feel like we're in, but sometimes if you're trying to get through a jungle fast, you can get all tangled up. So I always think like sometimes just that moment to pause can be a piece of advice that you've given there, of taking a moment. And then lovely Sue Down told me once, because I'm quite fast person, And
No, I need to slow down.
yeah, I was doing some coaching, and my coach was like, rather than being fast and furious, be slow and curious. I was like, oh,
That's a good one.
isn't it? It's a good one.
I'll
Um,
write that down.
yeah. But Sue also said something that you've just said, which is slowing down also helps to ensure that the people coming with you, because if we want to go far, we need to go together.
Yeah,
So we can go fast on loan, but I think if all of us take time, I know we're in the rapid review moment and we do want to
yeah,
quickly to help, but we also then can keep going back to sustainability. How do we sustain what we're doing
yeah,
for long term too? So there's a
most definitely.
question here for you from Gemma Louise Kendall. I imagine she's from a neonatal unit actually, because she's saying, is Make Birth Better doing anything for neonatal unit experiences? Could there be cross collaboration with other charities such as Bliss?
There is in the pipeline, again, that pace and slowing down and making sure that we have the capacity to do the work is really important and something that we're reflecting on at the moment. I've come in probably slightly like an excited puppy on let's go. And there's so much work to do that we have in our strategy. And yes, that is something that is on the cards, but not right now, not definitely not this year, early next year potentially, but something that we have considered and are working on moving forward. Yeah.
That's so good because I know for me, as somebody that's experienced trauma around my birth, my first birth with my
Yeah.
lovely son, Seamus,
So,
is nearly 20. He's going to be
oh
20
gosh.
next week. He's my eldest, and then I've got my wild Bill, who's I can hear next door. He's going to be 8 next week too.
Well,
And then my birthday at the weekend, but he was on neonatal unit, and I actually found that separation and the associated challenge
really difficult.
of the system, and that, like you said, back to the architecture even, and some of the ways that we have to navigate those systems. But
Yeah.
we thinking about how we join up together. And I always think one nice analogy for maybe for us to close is that creating horseshoes of connection where there's always room for new people to join. And I think
Yeah.
that's something that you do really beautifully at Make Birth Better is
Thank you.
making sure that people feel they can join. And so people like Bliss and organisations that
Yeah.
maybe haven't yet heard, hopefully from this hour together, more people hear about the work and organisations. So just to finish, if anybody did want to join, is there any scope for people to get in touch, or how would people find out what's next?
We're currently working on finalising the final priorities, but we had literally invited every single organisation possible to be part. Some declined, some hadn't got the capacity, but wanted to feed in different ways. And there are lots of organisations. It's not on socials, and people can see all the organisations that are listed. If anyone wants to feed into that, they can email into myself. They can find that on the website. But if there's any feedback that people want to give, we can make sure that it's heard and ingrained in
Yeah.
what those priorities look like.
Wonderful. And you can do that through the Make Birth Better website. So what's the Make Birth? You just pop it into Google actually, and it pops
Yeah,
up, doesn't
and
it?
it pops up. Yeah,
And
but
you can also get in touch with us at All for Maternity and across both of our socials, and we'll make sure that we're weaving in together and helping. And of course, all of the professional associations are there to listen and learn and be together to support families. There's some other brilliant charities like Tommy's and
there's
others
loads.
that's doing great work that you can contribute to. So thank you so much, Laura Rose, for being with
No
us,
worries. Thank you.
and to your whole team at Make Birth Better, and to your wife at LGBT Mummies, and to everybody that's joined us tonight. We're really grateful for everybody being part of the change that we want to see.
Thank you. Thanks for having me.
Bye, everyone.